Welcome to the very first episode of the Zesty Dietitian. I'm your host, Mackenzie Caldwell, registered dietitian, nutritionist, and founder of Feed Your Zest Nutrition and Wellness. I am so excited to be here and jump into the podcasting world. I've never done this before, so bear with me. Hopefully this isn't too rough. This very first episode of the Zesty Dietitian is sponsored by my very first provider webinar, which we did live a couple weeks ago, and it is now available on demand. The provider webinar is all about perinatal disordered eating and weight-inclusive nutrition care, and it is approved for continuing education credits by the Commission on Dietetic Registration. So if you are a dietitian or another healthcare professional, please do check that out. We had so much fun chatting, and there's been a really rich discussion in the comments for those that are watching the recorded version as well. So our topic for today in this very first episode is cortisol and inflammation. Like, what even is it? That is a question that I get all the time. And honestly, even before that, people will ask me, how do I lower my cortisol, or how do I reduce inflammation? And a lot of the times people don't even actually know what cortisol or inflammation are and how they affect their bodies, how it may or may not be affecting their fertility and their overall well-being, and what the roles of cortisol and inflammation are in the body that can actually even be positive and that aren't always something to be completely feared. So let's dive into, first off, what inflammation actually is. So inflammation is the body's response to an outside attack of some sort. It's an integral part of our immune system that is really, really important if we're sick or if we're injured. So you can think about inflammation as the response that might happen when you get a cut. For example, I burned myself the other day making sourdough bread. It hurt really bad. And the first thing that happened was that it kind of got a little bit red and hot. And so that is my body sending immune cells and blood flow to the area to bring nutrients and compounds that my body needs in order to heal that wound. So if I didn't have that inflammatory response, then the wound wouldn't heal properly. And if my body isn't getting the outside support that it needs, like a Band-Aid, it might produce even more inflammatory compounds in order to compensate for that. And this is really important because it prevents infection and it helps the wound close, et cetera, et cetera. We can also think about inflammation as something that is responsible for giving us a fever when we're sick. The body becomes inflamed and raises the body temperature so that the virus or the bacteria or whatever it is can be killed, because viruses and bacteria and other microorganisms need an ideal temperature to thrive. Of course, if that fever goes too high, then that inflammatory response is too much for our bodies and the temperature goes too high, then that's not good and we need to control the fever in the medical setting. So that's what inflammation is. So inflammation can be really, really helpful and important. And if you have an autoimmune condition, your body might be more prone to over-responding with inflammatory responses to things that aren't that big of a deal. If you have a history of trauma, we see that that is involved in an increased risk for certain inflammatory diseases like PCOS. And essentially, the body is in a state of inflammation when it's really stressed out. Another part of that inflammatory response is cortisol. Cortisol is a stress hormone that is made in the adrenal glands. The adrenal glands are these little teeny tiny guys that sit on top of your kidneys. Your kidneys are located right back here. And for those that are listening versus watching on YouTube, I am pointing to the back of my body, kind of right where my ribs are, right below my shoulder blades. That's where the kidneys are, and the adrenal glands sit right on top of that. The adrenal glands produce a lot of different steroid hormones. Cortisol is one of the kind of primary ones that we think about, and that is controlled by the pituitary gland. And there's a lot of regulatory processes in our body that help to keep cortisol in check so that it is used in the appropriate amount. Cortisol is responsible for helping us respond to danger. So let's say there's a hypothetical bear, we get scared or frightened or startled, cortisol will go up, and that is going to send blood flow away from our internal organs and out towards our limbs. So our fingers and our hands and feet and legs, so that we could hypothetically run away from said bear. I almost just started like going on a tangent about like the bear versus man thing on TikTok. If you guys have seen that, I would love to hear comments on bear versus man, what your opinion is. If you don't know what I'm talking about, don't worry about it. Just, we're going to move on. Anyways, we're going to stick with the bear just for the sake of this conversation. But yeah, I'll tell you that my answer is I would probably choose the bear. Yeah, I would probably choose the bear. Anyways, so if said hypothetical bear is there, we're ready to fight, fly, or freeze. So you might have heard about fight or flight mode versus rest and digest mode. We also have the freeze mode, which is kind of part of the fight or flight stress response. And that is kind of something that is ingrained in our biology that protects us to respond to danger. Now, if there isn't actual danger, and if we're just, our bodies overall are overly stressed out, whether that's a genetic defect, we're currently going through a trauma or experiencing PTSD, we have a history of trauma, you're really overworking yourself. I see this a lot with my very high achieving clients who are really trying to do well in work or school. If we're not sleeping well, then that cortisol can be higher. Under eating and over exercising also produce excessive cortisol. Another thing that we need cortisol for is getting up and going in the morning. A natural part of your circadian rhythm is that your cortisol will increase. It starts to increase like, well, its lowest point is in the afternoon, and then it will start to increase and it will peak around kind of 3 or 4 o'clock in the morning and then start to decrease. Go ahead and fact check me on that. I might be wrong about exactly what time of day that cortisol peaks. And if I'm wrong, I'll correct myself in the caption of this. I'm going to look that up later. But the point is that the cortisol being higher in the morning gets us up and moving and going for the day. It allows us to be alert. And that way we can do whatever it is that we need to do. One of the other things that cortisol does, besides getting blood to flow away from the core of the body and towards the limbs, so you can run away from said hypothetical bear, is it increases your triglycerides, which are little fat particles that circulate through the body, so that those can be used for energy. But even more importantly, and a more rapid, easy to use source of energy for your body is glucose. So increased cortisol will cause your body to release glucose from the liver primarily, and that glucose will then be used by the muscles and the organs in order to, again, run away from said hypothetical bear. Your body actually will also increase your cortisol a little bit if you haven't eaten in a while and your blood sugar is starting to dip. Then it will respond. And there's another hormone called glucagon that is involved in this process as well, that stimulates the liver to release its emergency stores of glucose so that you don't die from low blood sugar. This also happens in the middle of the night if you haven't eaten in a really long time. And it's something that I work on with my PCOS and gestational diabetes clients. And it's one of the reasons why an evening snack that has a little bit of carbs and a little bit of protein can help keep your blood glucose stable overnight, because then your body isn't having to rely on cortisol to then increase your blood glucose and keep everything stable, because that's just really hard on your body. So we've talked about the role of inflammation and how that is a normal part of just being a happy, healthy human, that we do need some amount of inflammation in order to just live. We've talked about cortisol and what that does and kind of how that is important, but also can go awry. There's a really good visual that I want to share with you. If you are watching this on YouTube, you'll see it. If you're listening via podcast, I'm going to try and describe the visual as much as possible, and I'll also include a link to this. But this is actually a Instagram post from one of my dietitian colleagues whose name is Rachel Hartley. And here we go. This is what she calls the bucket O inflammation. The more scientific term for this is allostatic load. So essentially, some people have a better kind of genetic setup to be able to handle more stressors, like trauma. I've said that a bunch of times, but also social isolation, general stress, excessive exercise. Some people are fine and they can tolerate all of that. It might not be amazing for them, but maybe they're just better equipped biologically to handle said stressors. Other people, especially if you have an underlying inflammatory condition like PCOS, like Hashimoto's, I would say that maybe arthritis might be another one as well. That could be kind of in this mix here. Your bucket, we can either think about that bucket as either being smaller or maybe it's just a little bit more filled already. So if we keep adding additional stressors like excessive exercise, not eating enough food, a ton of stress from life or work or relationships, not sleeping well, not eating well, and substance abuse, trauma, oppression, especially if that's chronic, or being socially isolated, we see that that affects people's ability to regulate inflammation and their cortisol levels as well. Then we might see that bucket potentially start to overflow a little bit, which is not good. That's where we start to see some symptoms like blood sugar irregularities, cholesterol being high, mental health symptoms, difficulty with consistently getting sick and not healing very well when you get sick. We can see that this might affect fertility. It might affect your other hormone levels, sex hormone levels, thyroid, etc. Your ability to produce progesterone adequately is a really big one. And potentially it might keep you from being able to ovulate. If the body does not feel safe, then it's not going to ovulate the way that it's supposed to ovulate consistently. That is a protective mechanism that the body has in place so that you don't get pregnant when you shouldn't get pregnant if the outside world has too many hypothetical bears. Again, your kind of intrinsic biological mechanisms don't know that the outside world may actually be totally fine and you might actually be safe. It just knows this is too much for me. We can't handle this. We don't have either enough nutrition on board or we aren't in a safe environment in order to reproduce appropriately. So sometimes this is a medical condition that is going to require treatment by an endocrinologist, and it's really complex and it might have nothing to do with food. It might have nothing to do with stress management. You could do all of the EMDR therapy that you want to, and it still might not help. You might need additional medical interventions. But all of those things that I just mentioned are helpful for bringing that baseline of inflammation down a little bit, or we can even think about pouring out some of the liquid from that bucket so that there's more space, so that if your car breaks down, that doesn't make you not get your period for that month. If you are, I don't know, deciding to have one weekend with friends that you have one more glass of wine than you usually do, that's not going to crazily impact your body's ability to produce healthy eggs, and that your egg quality will still be okay. So this is a theme that you'll hear a lot from me, whether you're a client or you keep listening to this podcast or you follow my other content elsewhere on the internet, that a lot of caring for our bodies and improving fertility, especially when we're looking at this from an evidence-based, body positive, weight inclusive lens, is so much more basic than what you'll see on social media. And you probably don't need an expensive supplement to help your body handle cortisol, to help it produce a regular amount of cortisol, or to lower inflammation overall. So you're probably thinking, okay, Mackenzie, great. I think I'm getting it. I think I'm grasping this. Maybe I have a couple follow-up questions, but I think I'm overall understanding what inflammation is, how cortisol is involved. I think I get it. Like, what do I do? What are those basics? So number one is that social determinants of health are important. So a social determinant of health is kind of a health factor that we see pop up over and over again, no matter how much we can control different things in the environment, in the world that we live in, that we consistently see the data in big public health studies. We consistently see the data that shows that this is affecting people's health and well-being overall. This is contributing to higher cortisol levels, and it's making people's bodies more sensitive to inflammation. Those are poverty, racism, pretty much any other ism, lack of housing, inadequate access to healthy foods, nutritious foods, etc. So that is always something that I want to acknowledge, that if you're listening to this and you feel like you can't afford the supplement that XYZ chiropractor on TikTok recommended, not only is there a lot more basic things that we can do, but also our voices and our votes do matter. And if we want to care for our community and help our community have better cortisol levels, if you want to have an impact on the future, then we need to think about how we can combat these systems of oppression and help everybody. That's a tangent for another day. But coming back, that's our number one thing, is that being stable and being in a stable environment is the first thing. If we can't do that, and if you need help with that, I'm happy to try and connect you with a resource in your community if I can. But most often reaching out to your health department or department of social work in the area can hopefully get you connected to the resources that you need. That said, assuming that you are in an environment where you do feel safe, you do feel generally okay with your finances, you have generally good access to food, it's consistent, you know when your next meal is going to be, then we can think about what are the individual behaviors that you might be able to incorporate to help your body calm down a little bit and keep cortisol at a place where it's a little bit more regulated. Number one is eating food consistently every single day, multiple times a day. What I mean by that is 3 meals and a couple snacks every single day, as much as humanly possible. Not as much food as humanly possible, but like as consistently as you can, trying to eat regular meals and snacks. This tells your body, hey, we've got the food that we need. You're going to be able to get your next meal in a timely manner. No need to release that extra cortisol. We're good. This is going to help blood sugar stay stable. Cortisol levels are going to chill out a little bit because the body is not having to become inflamed in order to get sugar and fat in your body to all the places that it needs to be. This is going to be a really big help in keeping your triglycerides at a better place and keeping your blood sugar at a better place if those are issues for you. We also see that this is a really, really huge factor for folks who deal with binge eating disorder, and can be a really important way to help manage anxiety and depression. It's one of the most basic human needs. And if we're not getting those needs, of course, your body's not going to be doing too hot. The next thing is to work on your sleep. 8 to 10 hours of sleep is what I recommend. You know, that's not perfect for everybody. There's some people that need a little bit less, some people that might need a little bit more. If you really feel like you're having a hard time with your sleep, it's important that you talk to your doctor and potentially get a sleep study done if you feel that that's necessary. But if you're pretty sure that you're not sleeping well because you're just scrolling on TikTok too much, I'm raising my hand here, then that's something that we can work on, that we can set some boundaries around and get into a good routine with sleep hygiene so that you are getting to bed at a regular time and that you're able to wake up at a time that works for you. And if you're not sleeping well all the way throughout the night, sometimes that's something that we can explore with medication with your doctor. And sometimes that's a blood sugar thing. And I mentioned earlier that higher protein evening snack That's paired with a little bit of carbs. Sometimes if that's going to help you have stable blood sugar throughout the night, that can help you sleep a little bit better as well. For some people, magnesium is helpful. I don't know that I found a difference with magnesium when I was trying it out, but it has helped some of my patients, and you can talk to your doctor or dietitian about the magnesium type and dose that's right for you. But sleep is really, 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 really important. We see studies on lack of sleep or kind of inconsistent sleep times, et cetera, really do impact blood sugar levels and cortisol levels, all of that. And I definitely see my patients that are nurses or doctors or other healthcare professionals that work night shifts. There's a lot of other professions that work night shifts too, but those are the ones that are coming to my mind. They often do have difficulty with sleep schedules, and that's something to really acknowledge. And something that I learned from a sleep doctor on TikTok is that trying to kind of find this like middle ground approach of having a little bit of overlap in your sleep schedule on the days off and the days that you have night shift. I forget exactly what she called that, and if I can find the video, I'll link it. But essentially that helps you that helps you sleep better, and it helps your brain not feel so wired out of whack when you are switching between night shifts and day shifts, or just night shifts and days off, etc. So eating enough, eating consistently throughout the day, sleeping well. Those are our number one basics that we can do. Another one that we can work on is kind of exercise as a way to kind of take care of your body, but not over exercise. So exercise actually is inflammatory, and that bucket O inflammation by Rachel Hartley that I showed had excessive exercise as one of those factors that contributes to inflammation because it is inflammatory. It actually does kind of break down muscle tissue a little bit, but if it's done in a way that you are kind of not overdoing it, that you're well fed and you're sleeping well, then the body can have an anti-inflammatory response to that exercise that's even greater, and that can be beneficial all around overall. And there's a lot of other mental health benefits for exercise as a coping skill. The CDC recommends 150 minutes per week of moderate exercise, or 75 minutes if it's more intense, and twice a week strength training. That's a lot less than a lot of people think they need. And that is including folks who are on their feet for an active job, or kind of lifting boxes or whatever it might be for their job. It doesn't necessarily have to be just planned intentional exercises. Walking your groceries home from the grocery store, lifting a toddler, those count. Those those activities of daily living, count. 100% they count. I find that for myself personally, I like to go on walks, and yoga is really, really beneficial, especially with all of the breathing that's involved in yoga. Some of my patients either don't like yoga or feel like it doesn't align with them spiritually. That makes complete and total sense. It's the breath work that we're trying to get in touch with, and we can incorporate some kind of non-religious, non-spiritual meditation practices if that's desired, or spiritually, if you feel like it's aligned for you, maybe within your own religion, there might be some meditation prayer that we can align with some or kind of coordinate with some breath work too. That can be really, really beneficial for the body overall. Personally, I like yoga because it combines movement, so I can get some pent up energy out of my body, keep it strong, get those anti-inflammatory benefits of movement, and the breath work, which we see consistently calms down the body, gets it out of fight or flight mode and into rest and digest mode. And learning those breathing exercises can also help you calm down when you are in really stressful situations, which is just helpful overall physically, but also mentally, so that you can be at your clear, so you can make the best decisions for you. You can communicate the best that you can. I am not just pulling these out of thin air. This is based in research, but I also know this not just because I'm a dietitian, but because I go to therapy too. So therapy, I think I probably should have talked about therapy before I started talking about exercise, because I think it's extremely, extremely important. And I wish we had better access to mental health therapy here in the United States. A fun but not so fun fact is that nutrition counseling is considered a preventive benefit. So a lot of people, we take Blue Cross and Aetna insurance in my practice. A lot of people get at least 6 visits covered completely 100%, no copay. But the same does not always apply to mental health therapy. And I personally think that's complete bullshit. Yeah, it is. It's complete BS. So anyways, mental health therapy is really, really important. It's a safe space for you to talk out what's going on up here. If you feel like you don't have access to the things that you need access to, especially if you're speaking with a social worker, that is literally their job, to connect you to resources. I see that as one of my jobs as well, and something I try to do for my patients as much as I can. But talking to a therapist can really help you with coping skills, work through whatever's going on. They're often trained in trauma for my clients that have gone through postpartum depression or a traumatic birth. Therapists that are trained with Postpartum Support International are fantastic and have so many tools to help you. But that mind work, that emotional work, it's going to help your body because the mind and the body are connected. They are intrinsically connected, and we cannot separate the two. So I always recommend that my clients consider mental health therapy. It has been so impactful for me personally, and I will not shut up about it. So those are our basics. So if we think about the pyramid of kind of how to lower your cortisol, how to help your body with inflammation, number one, the base is kind of access to a safe and healthy and financially stable environment. Right here, we need access to food, we need housing, we need lack of violence, we need good parenting. All of these things, we need safety from trauma and access to healing if trauma does occur, etc. That's the base, non-negotiable. We need that for everybody. The next one is eating consistently and adequately every single day, as consistently as you possibly can, and reaching out for support if there's disordered eating or crazy work schedule or crazy parenting situation, whatever's going on, reaching out for help if you need help, getting that consistent planning of meals going. And then above that, I mentioned exercise first, but I should have put mental health therapy here. Mental health therapy and just working on mental and emotional well-being overall and having those coping skills. Sleep should actually go below that. So sorry, we're going to go backwards here. Excuse me for this. So we have our kind of social determinants of health, the access to all the things that we need, eating consistently, sleeping consistently and adequately, working on mental and emotional well-being, exercise, but not over-exercising. And again, I didn't even mention too, if you have a disability, exercise might not be accessible for you, and that's a-okay. I would recommend reaching out to an occupational therapist or physical therapist to work with you on what you can do, if that's even within the realm of possibility, so that you can benefit from any movement that works for you. It doesn't have to be that 150-minute per week of moderate exercise if that doesn't apply to you. The tippy top of the pyramid is the stuff that you might see on social media. But honestly, we're going to even back up to the basics of adding in anti-inflammatory foods. Omega-3 fatty acids are found in fish and seafood. These are extremely impactful, especially when we think about the mental health impacts of inflammation and of high cortisol levels. And that's because the brain has a lot of omega-3 fatty acids in it. We also see that omega-3s are really important for fetal brain development. So eating seafood 2 to 3 times per week, if that is within the realm of your kind of religious and ethical eating values, and you don't have any allergies to those and you semi-enjoy them at least, then that's something I recommend. If not, then adding in omega-3 supplements is really important. There are vegan, algae, DHA supplements that exist if necessary. And there's plenty of fish oil supplements on the market. We give brand recommendations and dose recommendations to all of our patients, which I think is important, so that you're kind of figuring out on an individual basis what's right for you. And antioxidants are really important too. Antioxidants help with our body's response to pollutants in the environment that might cause damage to our body tissues, which is also known as oxidative stress or oxidative damage, that we don't need a supplement for antioxidants necessarily. Really, most of the antioxidants we can get are from fruits and vegetables. Eating enough fruits and vegetables after we do all of those other things. If you stop listening to this podcast, you never see any content from me ever again. If you just eat more fruits and veggies, I have done my job as a dietitian. Of course, eating excessive fruits and veggies can cause a lot of GI discomfort, and it can keep people from eating enough calories, enough fats, enough protein as well. So that is important to consider if disordered eating tendencies are kind of making you only eat fruits and vegetables, then we've gone too far, and we need to kind of scroll back down to the bottom of the pyramid again and kind of work our way back up. So fruits and vegetables and seafood. There are other sources of antioxidants that include nuts and seeds, whole grains, legumes. And there are other sources of omega-3s like walnuts, for example. But incorporating these foods can help fight inflammation overall. And it's not like you have to eat only dark green leafy vegetables like kale and like only eat berries to get your antioxidants. We have a lot of different types of antioxidants. Like, I'm going to throw out some big words right now, so it's okay if you don't know what this means, but an anthocyanin is one that gives fruits and veggies like a purple blue color. We've also have like our beta carotenes and our lycopenes, and those are responsible for red or orange or yellow or even pink fruits and vegetables. So shooting for a wide variety of different colors is going to give you a wide variety of different antioxidants, and variety is super, super important for getting enough of all different types of antioxidants overall. Occasionally, I will recommend an additional antioxidant supplement for one of my patients, or I might recommend that they incorporate a little bit of green tea if they enjoy that, and it's not going to kind of help push them over the edge with too much caffeine or anything like that. But those are our basics. Most people do not need excessive supplements to combat inflammation or to regulate their cortisol levels. Rarely do I ever recommend ashwagandha or maca or any other adaptogen, because there's so many other things that we can do first that are going to have a much, much, much bigger impact. And we have a lot more research on, especially if you are trying to conceive or you're pregnant. The research on safety of herbal supplements is just really lacking. And so we want to take it on a case-by-case basis. I guess the only other supplement that I will mention that can help with oxidative stress with sperm and egg quality is CoQ10. That one's pretty harmless, and the dose is like between 200 to 600 milligrams per day for men or women. I usually recommend it if you are either over 35 or if you are already at that point in your fertility journey where you are investing in IUI or IVF, or it's just been a while and you want to kind of throw spaghetti at the wall and see what sticks. I don't think it's necessarily important for every person to take that, because again, we have this giant pyramid of all these other things that we can do first, but that's our teeny tiny. Maybe we can even think about that like the little flag on the top of the pyramid that's saying, hello, we've completed all other steps, and this is one last little thing we're adding on. So the TLDR of this episode is that cortisol and inflammation are a little complex, but also treating them or kind of regulating them is less complex and less crazy than the internet makes it sound. And that there's a lot of super basic, easy to access ways for you to take care of your body, to regulate your inflammation and cortisol in your body, to improve PCOS, hypothyroidism, inflammation, help you ovulate regularly, help you produce enough progesterone, that do not require an excessive amount of crazy supplements or a weird, crazy diet as well. The last thing I will say that you're probably wondering, because it's everywhere on the internet, is sugar inflammatory? Are carbs inflammatory? Is dairy inflammatory? And is gluten inflammatory? I almost forgot to talk about these because it's so ingrained in my dietitian brain that the answer is no, that I sometimes forget to talk about it with my patients and they end up asking me. So dairy, we have zero evidence that dairy is across the board inflammatory for every person. If you have an allergy to dairy, yes, it's going to be inflammatory for you. An allergic response is an immune, a funky immune response, and responding to dairy with an allergic response is inflammatory. So if you're allergic, please don't eat it. Cut it out. If you have lactose intolerance, difficulty digesting lactose might be a little bit inflammatory of a response for you, but not nearly as inflammatory as an allergy. And you can absolutely still consume lactose-free dairy products or lower lactose dairy products like hard cheeses, for example. Many people are totally able to tolerate those just fine with lactose intolerance. And it's a really great source of calcium, vitamin D, protein, B vitamins, etc. Gluten is only inflammatory for people with celiac disease. That's something we know for certain. There might be a subset of people that have non-celiac gluten sensitivity, but I would, again, so much rather us try all of the other things in the pyramid before eliminating gluten, because we have a lot more evidence that that's true. And from my clinical experience, a lot of people with, I'm thinking of one particular client that had PCOS, endometriosis, and arthritis, was able to work with me and do all of those things and then still eat gluten. And she did not have any crazy flare-ups in any of her conditions. And she's Italian American, so she was very happy about being able to eat bread and pasta again. I think that these are kind of myths that get thrown around because people are desperate and they're grasping at straws to try and feel better. And I completely understand that. And it makes me really angry that people get caught in that trap. So we do not need to be cutting out gluten or cutting out dairy. You may have heard me talk about whole grains and fruits. Those are really important sources of carbohydrates that also have antioxidants. Eating enough carbohydrates throughout the day is important for keeping your blood sugar stable, again, so that your body doesn't have to rely on cortisol to bump those glucose levels back up. So eating carbs consistently throughout the day is important. And maybe we'll talk about blood sugar balance in a future episode. I definitely have an explanation here on my YouTube if you want to check that out, but I might do a new episode soon. And sugar, overall sugar is in a lot of different things, but ultimately, no, it's not inflammatory. In fact, it's just kind of there. And if we are kind of working on building balanced meals and snacks, there's absolutely an amount of sugar that can be present. I am much more concerned about alcohol, about substance abuse, and about systemic oppression, chronic stress, trauma than I am about your sugar intake by far. So this is my spiel. This is my spiel about inflammation and cortisol. I hope this was really helpful for you. Again, if you have questions or comments or responses to this podcast episode, I would love to hear them. If you have suggestions for future podcast episodes, please put them in the comments. I don't even know how this episode went. I'm going to go back and listen to it now, but this is my very first one, and I really enjoyed talking in this format. I feel like sometimes I am a little bit limited on TikTok and Instagram with the time limits. And so this is just like a really fun way for me to talk about things that I'm passionate about, to get out some free education for you, my listeners. Hopefully that will exist at some point. And if you want to learn more about what we offer here at Feed Your Zest Nutrition and Wellness, head to www.feedyourzest.com, and we cannot wait to hear from you. Have a lovely day.